Well, welcome back, everyone. Thank you for coming again. Now, I'm going to jump in straight away today with some numbers. It's Wednesday, the 11th of March. And basically, that which I've been fearing since January is unfolding. And what we anticipated actually way back in January is unfolding. So the figures as of today, so far there's been 120,000 cases nearly, over 4,000 deaths. But I'm pleased to say that over 66,000 have made a recovery. Now, currently, there are over 42,000 people with this virus in the world at the moment. That's the current figure. And it's estimated that 42,620 of these, 88%, have a mild condition. And this is excellent. And indeed, a proportion of these will be asymptomatic. Maybe 20% of these will hardly know or maybe not even know at all that they have the infection, that they have the coronavirus disease of 2019. So good news there. But this number here is concerning. It's concerned me since I read the early data from China, again back in early February. Serious or critical. Now, these are people that are going to need some level of medical intervention. And this is like 12% of the number of people infected. So at the moment in the world, it's that. And as we go through with the numbers we've got now, we'll see that this is already causing significant difficulties. My other concern is the lack of data. I'm very concerned that in poorer developed countries where health observation and treatment facilities are less available, that there is a lot of undiagnosed cases at the moment. But of course, I don't know that because we don't have the data for that. But that's a worry, and it's a strong suspicion at the moment as well. But let's shine the light on the areas that we do know to begin with. Now, Italy has got a lot of cases and a lot of deaths and a frighteningly high death rate. We'll look at a reason for that probably in a minute. In fact, we'll do that now. High death rates in Italy, maybe because severe cases are sampled. Now, this happens at the start of an epidemic, that there's a lot of cases that aren't diagnosed, and the cases that come to the attention of the healthcare providers tend to be the more severe cases. So that can make that look higher than it actually is. I think that is the case. I believe strongly that is the case, and I certainly hope that is the case. Italy, of course, is closed down, the whole country, 60 million people basically closed down, asked to stay at home, and public gatherings banned. Now, another reason that the epidemic has sort of taken off in Italy so quickly, or apparently so quickly, is because basically Italy was caught on the hop. It was caught unawares. It was caught sleeping, whatever analogy you want to use here, because there's been spread for some time. The epidemiology now shows that there's been spread for some time in Italy and it just wasn't detected. Poor surveillance. So this is why it's so vital that we have good surveillance. High index of suspicion for people with cough, dry cough, fever, myalgia, achy muscles, undue fatigue. High index of suspicion for these things, and get these people in isolation. So it was probably spreading for some time before there was awareness in the healthcare providers and before there was awareness in the public. This is just so important. Everyone in the world needs to be aware. Lack of awareness allowed this infection to spread in Italy. We need to be aware. Global surveillance is now needed, as we've looked at yesterday. A lot of the transmission in Italy was probably within families. There was an additional 168 deaths on Monday, and this high death rate, as we've said, is probably because the more severe cases are being sampled. So because Italy was caught on the hop, we need to learn from their experience. We need global containment now. We need to learn from the Italian experience. This is an advanced European country, advanced healthcare systems, and yet this massive degree of infection. Now, Professor Grusselli is the senior doctor in charge of coordinating intensive care facilities in Lombardy in North Italy, where the epicenter of this outbreak is. And he reports 600 patients in intensive care with a median age of 65. Now, the median, as you probably remember from your statistics, is the one in the middle. So that means there was an equal number of patients under 65 as over 65 in intensive care. So this means there's a lot of patients younger than 65. Now, I was surprised to learn this and concerned to learn this. They're suffering from bilateral pneumonia resulting in acute respiratory failure, what we would call a type 1 respiratory failure. Now, let's go on to some good news. In Lombardy, the area in North Italy, the professor on his interview said 3 or 4 neonates were infected, and they were not severely ill. What a relief that really was. So in the entire area, just a few neonates is the first 6 weeks of life, and they're not severely ill. And children don't seem to be getting sick. Good news, children don't seem to be getting sick. But of course, children can carry it home to their parents, which is not so good news, of course. So children, now the data on this is not clear at the moment, but it's very likely that children are catching the virus and potentially spreading it to their parents. It may be that they catch it less, but it certainly seems that they're not getting sick like adults do, which is excellent news. Now, Professor Grusselli had some messages for us. He pointed out that Italy had this first. Therefore, aren't we in the UK, for example, so lucky to have this few weeks to learn from the Italian experience? But are we learning from the Italian experience?
Nope, not learning.
I'll leave that.
Blessed thing.
If you're not very careful in controlling this disease, your system will be overwhelmed. So what he's saying is that the medical facilities in Italy are challenged, to put it mildly. And he's saying if there's more cases, whatever medical system you've got, you won't be able to cope. You need to reduce the number of cases that we have all at the same time. That is what we absolutely have to do. So again, what the professor is telling us, and this is something I've been going on about for some time myself, is here we have a graph with the number of cases and the time. The number of cases and time. Now, left to its own devices, what will happen is the number of cases will increase very rapidly like this. And we'll end up with a peak of many cases at the same time. Then it will start to drop. But during this peak time, there's going to be an awful lot of people with the infection. And we know that when people have the infection, we can expect, as we've just learned from the Italian data, or we've just learned from the world data really, that 12% of these were serious or critical. So the bigger that number is, the bigger that 12% is going to be. And if that number's big, we can't look after them all at the same time. So what we have to do is flatten this out like this. And the only way we're going to do that is by social isolation and public health measures. Now, a vaccine would do this for us, but we don't have a vaccine. So we have to use these old-fashioned non-pharmaceutical interventions. So Professor Grusselli is saying, well, this is kind of what's happening in Italy and we're struggling. You've got the time to learn from us. Institute these containment measures that are necessary and make your curve look like that, not like that. This is what we need to do. That's what the professor's message is. Because in Italy, he says, a bomb has exploded. This is a rational scientist, a clever doctor, and he's using terms like a bomb has exploded. Public has to change its behaviours. Global containment now, the public has to change its behaviours. And we'll look at some cases of where this is happening and where this is not happening. And he actually said it's worse than a bomb because this is kind of going on all the time. A bomb is one episode. You can triage and deal with the public, deal with the
Hear what he said? Worse than a bomb. Because it's happening all the time. On and on and on and on and on and on. Worse than a bomb. It's not hard to understand. Did I have this set up? Yep. NASDAQ futures limit down. Crude crashes after Trump announces EU travel ban. Huh? That's for sure. Market's gonna dip even more. I was thinking about buying in. I thought we hit the bottom. Guess we're not hit. We have yet to hit the bottom. This guy is awesome. What's his name? Dr. John Campbell. Been following him for at least since the beginning of this outbreak. Let's turn this bad boy back on. Ugh, of course. It's about to shut off.
and per day. So that's encouraging, and the results come back in 48 hours. And this test is sensitive and specific. Now, these are important points in testing. It's sensitive. That means if the virus is in the sample, the test is sensitive and will detect the presence of the COVID-19 virus. This means we shouldn't get false negative tests, or not many false negative tests, where someone tests negative if they actually have the virus, because it's sensitive and it's specific. So it doesn't pick up the presence of other viruses. So we shouldn't get too many false positives either. That means we shouldn't get false negatives. That means we shouldn't get false positive results. So we have a sensitive and specific test, and we're rolling out lots of them. So that's good for surveillance. This is the success of science so far in this outbreak. Now, science will be successful in a vaccine. It's just going to take time. I believe science will be successful in therapeutic treatments. It's just going to take time. Now, 12 regional labs at the moment doing the testing, and that's going to be increasing to many other hospitals who have sufficiently secure facilities. Now, these aren't the ultimate secure facilities like Porton or CDC or somewhere like that. They're just reasonably secure facilities. So there's going to be much more localised testing in the UK. And we've managed to postpone one football match in my country. So one football match has been, one mass gathering event has been cancelled here. So that's, I suppose we have to be grateful for that. Now, this seems to be a football manager who came back from Greece with the infection. And Greece currently allegedly has 89 cases. I'm just wondering how good the surveillance is in Greece. I don't know, I'm just wondering out loud. Now, the Czech Republic seems to be doing well. A taxi driver was identified as having the infection, but there was no patient zero, so they don't know where he got it from. Now, this is a bit worrying because it means there's probably some community spread in the Czech Republic. The response is encouraging. Bangor public events over 100 people. All schools except preschools are closed starting yesterday. And the testing people at the border for the temperature, and then testing have been necessary for COVID-19 cases at the border so far. So I think what we're seeing is a mixed bag worldwide. Some people taking this seriously, other places taking it less seriously. Other places with a response which is slower than we would like to see. But we all need to move together on this. We need centralised control, and we have to take our part. Because we need to do it. So we need good respiratory hygiene. We need to have these containment measures. We need to be proactive. The Italians are now reacting. They failed to be proactive. They've given us a case study. We've had a heads up, we've had a warning to be proactive. Are we using that time, or are we squandering it? Because we now need. So remember, no shaking hands, no hugging, no kissing. Keep your hands clean, because. Sorry if you're getting bored with those. Right. Well, welcome to this talk where we're going to be thinking about infection, what infection is and how we recognise infection. Now, infection means the presence of microorganisms in the body. So normally the tissues of the body are supposed to be sterile. But if we get viruses or bacteria in the body tissues, this will cause infection. And if these are, well, welcome back everyone. Thank you for coming again. Now let's jump in straight away today with some numbers. It's Wednesday, the 11th of March. And basically that which I've been fearing since January is unfolding. And what we anticipated actually way back in January is unfolding. So the figures as of today, so far there's been 120,000 cases nearly. over 4,000 deaths. But I'm pleased to say that over 66,000 have made a recovery. Now, currently, there are over 42,000 people with this virus in the world at the moment. That's the current figure. And it's estimated that 42,620 of these, 88%, have a mild condition. And this is excellent. And indeed, a proportion of these will be asymptomatic. Maybe 20% of these will hardly know or maybe not even know at all that they have the infection, that they have the coronavirus disease of 2019. So good news there. But this number here is concerning. It's concerned me since I read the early data back in China, from China, again back in early February.
It's a plague of monkeys.
Now, these are people that are going to need some level of medical intervention.
I want to keep that.
And this is like 12% of the number of people infected.
Bloody plague of monkeys.
So at the moment in the world, it's that.
Come on, there.
And as we go through with the numbers we've got now, we'll see that this is already causing significant difficulties.
Save that.
My other concern is the lack of data. I'm very concerned that in poor developed countries where health observation and treatment facilities are less available, that there is a lot of undiagnosed cases at the moment. But of course, I don't know that because we don't have the data for that. But that's a worry, and it's a strong suspicion at the moment as well. But let's shine the light on the areas that we do know to begin with. Now, Italy has got a lot of cases and a lot of deaths and a frighteningly high death rate. We'll look at a reason for that probably in a minute. In fact, we'll do that now. High death rates in Italy, maybe because severe cases are sampled. Now, this happens at the start of an epidemic, that there's a lot of cases that aren't diagnosed, and the cases that come to the attention of the healthcare providers tend to be the more severe cases. So that can make that look higher than it actually is. I think that is the case. I believe strongly that is the case, and I certainly hope that is the case. Italy, of course, is closed down. The whole country, 60 million people, basically, closed down, asked to stay at home, and public gatherings banned. Now, another reason that the epidemic has sort of taken off in Italy so quickly, or apparently so quickly, is because basically Italy was caught on the hop. It was caught unawares. It was caught sleeping, whatever analogy you want to use here, because there's been spread for some time. The epidemiology now shows that it's been spread for some time in Italy and it just wasn't detected. Poor surveillance. So this is why it's so vital that we have good surveillance. High index of suspicion for people with cough, dry cough, fever, myalgia, achy muscles, undue fatigue. High index of suspicion for these things, and get these people in isolation. So it was probably spreading for some time before there was awareness in the healthcare providers and before there was awareness in the public. This is just so important. Everyone in the world needs to be aware. Lack of awareness allowed this infection to spread in Italy.
We don't want it to spread.
We need to be aware. Global surveillance is now needed, as we've looked at yesterday.
What's going to happen?
A lot of the transmission in Italy was probably within families. There was an additional 160 deaths on Monday in this high death rate. As we've said, it's probably because more severe cases are being sampled.
It's going to be bad.
Italy was caught on the hop. We need to learn from their experience. We need global containment.
Stinky monkey. Yes.
We need to learn from
the stinky monkey. Stinky
this is an advanced European country, advanced healthcare systems, and yet this massive degree of infection.
Are you the stinky monkey?
Now, Professor Griselli is the senior doctor in charge of coordinating intensive care facilities in Lombardy in North Italy, where the epicenter of this outbreak is. And he reports 600 patients in intensive care unit with a median age of 65. Now, the median, as you probably remember from your statistics, is the one in the middle.
Back to Dr. John Campbell.
So that means there was an equal number of patients under 65 as over 65 in intensive care.
We don't want these people to get sick. Come on.
So this means there's a lot of patients younger than 65. Now, I was surprised to learn this and concerned to learn this. They're suffering from bilateral pneumonia resulting in acute respiratory failure, what we would call a type 1 respiratory failure. Now, let's go on to the good news. In Lombardy, the area in North Italy, the professor on his interview said 3 or 4 neonates were infected and they were not severely ill. What a relief that really was. So in the entire area, just a few neonates is the first 6 weeks of life and they're not severely ill. And children don't seem to be getting sick. Good news, children don't seem to be getting sick. But of course, children can carry it home to their parents, which is not so good news, of course. Children. Now, the data on this is not clear at the moment, but it's very likely that children are catching the virus